this story. Now, for your health today, we want to take a look at dental care, even as simple as how to brush your teeth the right way. So allow me to introduce my panel this morning. Straight closer to me, I have Dr. Beatrice Kiptanui. She is a specialized orthodontist, but for her, she has specific interest when it comes to research and treatment of the cleft lip and palate. On my far end, I have Dr. Wandia Mwangi. She's a specialist orthodontist at Orthodontics Clinic. Ladies, it's so good to have you here with us this morning. Such an interesting conversation to have. Dental care, and I can see you already have everything set up. All right, so let's begin perhaps by describing, and Dr. Wendy, I'll begin with you. Okay. What is dental care? Is it just brushing of teeth? Take us through that, what we mean by dental care.
Right, dental care begins with, yes, it does begin with caring for your teeth, so brushing at least twice a day or after every meal, flossing between your teeth, but also things that we eat generally can affect our dental health and our general health. So we tend to think of the whole patient or the whole person. So a well-balanced diet is always good for your dental care. Less sugar in your diet, less sodas, less things that can cause tooth decay, as well as looking after your general well-being, because certain medical conditions can also affect your dental health.
Right. So dieting and what you eat can affect your teeth?
Yes.
How so?
Because sugar is a known cause for causing tooth decay or cavities in teeth. Basically, having a lot of refined food and not a lot of fibrous food is not as good for your teeth.
Right.
So the traditional diet is actually the best thing for your dental health. So we try and encourage patients not to snack a lot between meals, but to have a good, well-balanced diet.
All right, all right. So, Dr. Beatrice, allow me to jump in to bring you into the conversation. For you, you're very specific when it comes to cleft lips and palate. So, for people living with that, how they take care of their dental, does it change? Is it different for them?
Yes, the cleft of the lip or palate alters a lot of things with the development of the face and the mouth.
Right.
It tends to be that there are a lot more openings that connect the nasal cavity to the oral cavity. So you get a lot of problems with keeping things clean. You also have problems with eating. So where there is significant care of patients who have a cleft of the lip or the palate, they have something that blocks that connection between the nasal cavity and the oral cavity. That too has to be cleaned. When they're eating, it has to be managed so that the food does not go from the mouth up into the nasal cavity. So it makes it a little bit more complex for the patient, and particularly if they're young, for the mother looking after.
So for them, dental care is way different perhaps from us, how we would take care of our own.
Absolutely, it's far more rigorous, so they require a lot more support.
And more time.
And more time.
All right. So, Dr. Wendy, there's something that you say that also caught my attention. Brushing after every meal.
Yes.
So after I have my breakfast, I brush. After I have my lunch, I brush. After I have dinner, I brush. Kenyans are busy
a lot
people.
Of brushing. Brushing doesn't have to take long. It's a 2-minute process, as long as you don't have braces in your mouth and things like that. But it's a very quick, routine process. Brushing after lunch, I mean, I could forgive you for not brushing after lunch, but breakfast and the evening meal are important, especially the evening meal.
Right. And these are like special, this are, do I call them rules that we should be teaching people from such a young age?
I think so. Right from our children, I think it's a good practice, because when we go to sleep, if we don't brush our teeth before, when we're asleep, everything slows down. We don't produce as much saliva in our mouth. So if there's food lodged in your mouth, it's a very good opportunity for germs to start to cause tooth decay. So especially brushing at night and flossing once a day.
Flossing.
Yes.
Okay. So we're going to come to flossing in just a minute. But take me through perhaps the simple treatments that people can do at home when it comes to proper hygiene when it comes to your dental care. So of course we said the brushing, and of course you'll take us through the proper way to brush.
Yes.
You said flossing. What else can we do at home, especially for people maybe who struggle with proper hygiene when it comes to their dental care?
Yes. So it starts with brushing. There's different ways to brush. So if you have somebody who's maybe got arthritis or someone who's got limited movement, there's electric toothbrushes that can really reduce the need for the patient or the person to have to move that toothbrush in the correct way. It starts with the diet. You can use mouthwash, which usually contains something to take away the germs that cause bad breath, to take away the germs that cause tooth decay, but it's not really a substitute for brushing. And some of these mouthwashes have fluoride added to them. And fluoride, as long as you don't swallow it, as long as you just use it on the teeth, it's a very good source for strengthening the teeth.
Okay.
So using a fluoride toothpaste and fluoride mouthwash is also a good idea.
Okay, so Dr. Beatrice, talk to me about perhaps the effects, the ripple effects, should I say, that are there if one doesn't take care of their dental properly. The reason I say this, you know, you hear a lot of people say they have a toothache, and that toothache can somehow affect your migraine, etc., and how you eat. So talk to me about that, the ripple effect that if a poor dental care has.
Okay. So we generally divide oral hygiene or dental care into two aspects.
Okay.
There is the care of the teeth, which is the hard tissues and sometimes the bone, and then the soft tissues, which are classed as the periodontium. And the element that is affected mostly by your diet is the harder tissue, the enamel. The diet needs to be much less acidic to reduce the risk of having a hole inside your tooth. So the substance of your tooth is burrowed away by the acid that's in the diet if you're having a lot of sugar, high frequency, and that is what we call a cavity. So the cavity opens up access to the nerve of the tooth, and that's when you start to get pain.
It's not a good feeling.
It's not a good thing. So we try and recommend that you keep all your sugar to meal times so that you can prevent the development of caries or decay. So that's the hard tissues, and the repercussions of having a poor diet is that you end up with holes in your teeth, which is the caries.
And all this is just from your diet,
This is
which
mostly
Dr.
from your
Wendia
diet.
has really emphasized on.
Indeed.
Okay.
Then moving on to the soft tissues, which is the gums, when you do not brush your teeth and gums, then the food sits around the margin where the tooth, if you imagine this is the tooth and the gum sits around the neck of the tooth, the food will get stuck in that area around the tooth.
So it's also important to brush your gum as well.
Absolutely, absolutely. In fact, it's the most important area to focus on when you're brushing. And I'm sure Dr. Wendia will show us in a short while how the toothbrushing can be done to prevent that necking area of the tooth being affected by food that gets stuck.
And now that we're here discussing the sensitive part, when it comes to brushing, if you brush your gum, you tend to bleed. The people who tend to bleed.
Yes, that's correct.
So what causes that? Is it because one is brushing too vigorously on your gum area, or is it something else that causes that?
The cause of bleeding with gums is inflammation. Inflammation is caused by an irritation. So the food that is stuck around that neck of the tooth is what causes the gums to swell. And the swelling is what, when you come and brush, is actually causing the bleeding. So bleeding is not a normal thing. It shouldn't be considered normal. Okay. It's an indication that there's something that's irritating your gums. So we recommend strongly that if there's bleeding of the gums, that you go and see your dentist, because your dentist can help with cleaning that stuck, hardened food, which is called tartar, that is around the gums.
Dr. Wendia, is it okay for me to get my teeth whitened?
Absolutely, if you would like to. It's a cosmetic procedure.
It's okay. It's healthy. It's fine.
It's all right, but it does have side effects like any treatment. So some patients find they try the whitening process, either at home through using whitening toothpaste.
And YouTube videos.
And YouTube videos. Or they go to the dentist and try what the dentist offers. And the dentist will either give you a home kit, where you have a special bleaching tray, like a cover that fits over the teeth. And you put this bleaching medication inside, and you wear it for a prescribed amount of hours every evening until the whitening happens. Or you could do it in the chair, in the dental chair.
How long does the whitening process take?
It depends. If it's the home kit, you know, it can be varied by the patient, for example. You basically whiten until you get to the shade that your target shade of white.
And once you get to your target shade of white, how often then do I go to whitening, or then that's it?
You may need to top it up because there are certain things that can cause the teeth to start to lose their whiteness again.
Okay.
So sometimes, even if you have it done in the dentist chair, sometimes you may still have to top up at home with the home kit. But it can cause sensitivity. So if you're someone with very, very sensitive teeth, you might find whitening a problem because of that.
Why is flossing so important? You've talked about it. And think about flossing. Not so many people know how to floss. Again, perhaps maybe they saw it on a movie and then they learned it from YouTube. You know, it's not as easy as picking up your brush and brushing. And it's perhaps attributed to the middle class and the upper class, right? So talk to me about why it's important to whiten, and that you just can't take any string and then start, you know, whitening.
Yes, it's good to use dental floss because it glides. It's designed to glide very smoothly between the teeth. And as Dr. Beatrice alluded to earlier, there's the neck around the tooth. And it's not just the front and the back of the tooth, but it's also the sides where the teeth touch each other. So your brush will not normally reach those areas in between the teeth. So you need something to dislodge any plaque. Plaque is germs, plaque that is lodged in there, or food, so that you don't start to get holes or cavities in the teeth, as well as gum problems between the teeth.
Okay. All right. So, Dr. Wendy, would you like to take us through the right way to brush teeth?
Sure. So when you don't have braces in your mouth, you can spend 2 minutes. So you spend 1 minute on the upper jaw and 1 minute on the lower jaw. You have to remember there's 3 surfaces to the teeth. So there's the cheek surfaces or lip outside surfaces, the tops of the teeth, and the insides of the teeth. So just to demonstrate a very simple measure, children would use a smaller toothbrush, probably half this size. You start at the back, and you have to be systematic. And you have to go around this way.
Oh, so it's not just parasha. You have to go around.
you have to actually brush along the gum lines, like Dr. Beatrice said, and come around systematically so you're not missing any areas.
Right.
And then you go all the way around to the other side so that you're not missing any teeth. If your teeth are crooked, you've got a tooth up here, you've got to remember to brush that tooth that's crooked. And then you've got to go to the tops of the teeth, because they have these grooves and pits, and in there you can get food and bacteria lodging, germs, and then you do the insides. So you start at the back, and then again you work all the way around, and then after that you can floss.
Okay, yes. But and then it's also important to brush your tongue.
Yes, it is, because we have these germs that can stick to the tongue that can cause bad breath. Right. And it's good to brush them off so that everything is fresh.
All right, and I can see you still have teeth that have braces.
Yes, there's different types of braces there.
Okay, so would you, how different is it when it comes to brushing teeth for those that wear braces?
So you've got to get around, on this, for example, you've got to get around, it's a lot trickier, it takes longer. So I usually tell my patients to spend double the time when they're brushing their braces because they have a lot of attachments to brush around.
And they can't remove? Well,
there are some that you can remove, so those are easy. You remove them and then brush your teeth and put them back in. But these are fixed ones, and you've got ones on the outsides of the teeth, and you've got ones on the insides of the teeth.
And for people who have grills, you know, especially in this day and age with young people and grills, what would your advice be on that?
You mean the fixed ones?
Yes.
Yeah. So you need to brush along the gum line like we showed you.
Yes.
And then you've got to brush the bottom part of the brace
as well.
And then you've got to actually go under the wires. So there are some special tiny little brushes. They look like tiny Christmas trees. And they go under the wire, and they brush each side of each attachment.
Okay.
So it's actually quite a process. And then not to forget to brush the inside where the brace is not stuck on.
All right. Thank you so much, ladies. This has been interesting and proper information on that. So brushing during lunchtime, I'll try and begin that as well. All right. So Dr. Wendy and Dr. Beatrice helping us go through dental floss and dental care the proper way. Let's take a commercial break. We'll be right back.